Dexibuprofen is a nonsteroidal anti-inflammatory drug NSAID that is closely related to ibuprofen. Its pharmacology involves several key mechanisms of action. 1. Anti-inflammatory, dexibuprofen, like other NSAIDs, inhibits the activity of an enzyme called cyclooxygenase COX. Specifically, it primarily inhibits ZOX1, which is involved in the production of prostaglandins that mediate inflammation. By reducing prostaglandin production, dexibuprofen helps to decrease inflammation and pain. 2. Analgesic pain relief. By inhibiting COX1 and COX2, dexibuprofen reduces the production of prostaglandins involved in pain signaling. This results in pain relief, making it effective for various types of pain, including musculoskeletal pain, headaches, and menstrual cramps. 3. Antipyretic fever reduction. Dexibuprofen, like other NSAIDs, can help lower fever by reducing the production of prostaglandins in the brain's temperature-regulating center, the hypothalamus. 4. Platelet function. Dexibuprofen can affect platelet function to some extent, which may contribute to its anti-inflammatory and antithrombotic effects. 5. Pharmacokinetics. Dexibuprofen is available in both racemic containing both S and R enantiomers, and dexibuprofen-specific formulations containing only the S enantiomer. The S enantiomer is believed to be responsible for most of its therapeutic effects. Dexibuprofen is absorbed relatively quickly after oral administration, with peak blood levels reached within a few hours. 6. Metabolism and excretion. Dexibuprofen is primarily metabolized in the liver and excreted through the urine. Pain and inflammation. The typical adult dosage for dexibuprofen is usually 200 to 400 milligrams mg. Every 4 to 6 hours is needed for pain or inflammation. The maximum daily dose should not exceed 1,000 to 100 milligrams. Fever reduction. For reducing fever, a similar dosing regimen is often used, with doses of 200 to 400 milligrams every 4 to 6 hours as needed. Again, the maximum daily dose should not exceed 1,000 to 100 milligrams. Menstrual cramps. Dexibuprofen can be used to relieve menstrual cramps. A common dosage is 200 to 400 milligrams every 4 to 6 hours as needed, with the maximum daily dose not exceeding 1,000 to 100 milligrams. Rheumatoid arthritis and osteoarthritis. In cases of chronic conditions like rheumatoid arthritis or osteoarthritis, your healthcare provider may prescribe a specific dosing regimen tailored to your needs. This could involve higher doses or extended-release formulations. Dexibuprofen, like other nonsteroidal anti-inflammatory drugs, NSAIDs, can cause a range of side effects. Common side effects associated with dexibuprofen use may include 1. Gastrointestinal distress. This is one of the most common side effects of NSAIDs. It can include symptoms such as stomach pain, heartburn, nausea, vomiting, indigestion, and diarrhea. NSAIDs can irritate the lining of the stomach and increase the risk of gastrointestinal bleeding or ulcers, which can be serious. 2. Dizziness or drowsiness. Some individuals may experience dizziness or drowsiness while taking dexibuprofen. It's important to avoid activities that require mental alertness, such as driving, until you know how the medication affects you. 3. Headache. Paradoxically, NSAIDs like dexibuprofen can sometimes cause headaches in some individuals as a side effect. 4. Fluid retention. Dexibuprofen can lead to fluid retention or edema in some people, resulting in swelling of the ankles, feet, or hands. 5. High blood pressure. Prolonged use of NSAIDs, including dexibuprofen, can potentially raise blood pressure in some individuals. 6. Kidney function changes. NSAIDs can affect kidney function, and in rare cases, they may cause kidney problems. Symptoms may include changes in urine output, blood in the urine, or swelling. 7. Allergic reactions. While uncommon, some people may experience allergic reactions to dexibuprofen, which can manifest as rash, itching, swelling, or difficulty breathing. Seek medical attention immediately if you experience signs of an allergic reaction. 8. Liver enzyme changes. In rare cases, NSAIDs can cause changes in liver function tests, but severe liver problems are very rare with short-term use. 9. Cardiovascular effects. Dexibuprofen, like other NSAIDs, may slightly increase the risk of cardiovascular events, particularly in individuals with pre-existing heart conditions. Dexibuprofen, like other nonsteroidal anti-inflammatory drugs, NSAIDs, can interact with various drugs. Some common drug interactions with dexibuprofen include 1. Other NSAIDs. Concurrent use of multiple NSAIDs, such as ibuprofen or aspirin, can increase the risk of gastrointestinal bleeding and ulcers. 2. Blood thinners anticoagulants. Dexibuprofen can enhance the blood thinning effects of medications like warfarin, increasing the risk of bleeding. 3. Corticosteroids. When combined with corticosteroids like prednisone, dexibuprofen may increase the risk of gastrointestinal bleeding and ulcers. 4. Lithium. Dexibuprofen can elevate lithium levels in the blood, potentially leading to lithium toxicity. 5. Methotrexate. Concurrent use of dexibuprofen and methotrexate can increase the risk of methotrexate toxicity. 6. Certain blood pressure medications, antihypertensives. Dexibuprofen can reduce the effectiveness of some blood pressure medications. 7. Selective serotonin reuptake inhibitors, SSRIs. Combining dexibuprofen with SSRIs like fluoxetine may increase the risk of bleeding. 8. Diuretics. Dexibuprofen can reduce the effectiveness of diuretics, which are often used to treat high blood pressure and heart conditions. 9. Antacids. Antacids may decrease the absorption of dexibuprofen, potentially reducing its effectiveness. 10. Alcohol. Alcohol consumption while using dexibuprofen can increase the risk of stomach irritation and bleeding.